Ano?
A pleasant morning to each and everyone. Welcome to Inclusionem 2021, strengthening the homeschool partnership and education of children with special needs in the new normal. Today is indeed a very wonderful day for all of us. Before we begin, let us start asking God's grace through an opening prayer.
Amen. Tagapagkaloob ng
Recording
lahat
in
ng
progress.
kaalaman at guro ng mga guro, bigyan po ninyo ng pagkalinga ang aming mga guro. Biyayaan ninyo sila ng kahandaang linangin ng aming murang isipan at huwag magsawa kapag di makahabol ang tinuturuan. Pagpalain nawa ang kanilang mga pusong nagdiriwang sa tuwing kami nagwawagi at nag-aalo sa tuwing kami nadadaig. Pagkalooban ninyo sila ng mahinahong pagtatiyaga sapagkat ang landas ng kaalaman ay hindi madali. Pagningasin ninyo sa kanila ang maapoy na diwang nagpapaliyab sa kagustuhan naming matuto. Tulungan ninyo silang makita ang galing sa bawat mag-aaral. Wala sa marka ang halaga kundi sa pananalig nila. Ikintal ninyo sa kanila ang walang pagkauhaw sa karunungan at bagong kaalaman at karanasan ay di dapat katakutan. Turuan po ninyo silang masiglang abutin ng alapaap, kasing sigla at kasing tayog ng sarili naming pangarap. Pagpalain po ninyo ang mga gurong nauna sa amin. Ang nagawa nila ay napapakinabangan pa rin. Tanglawan po ng iyong mabuting halimbawa ang kaguruan upang makapagtayo sila sa pamamagitan ng kanilang pangungusap, upang makapagmahal sila sa pamamagitan ng kanilang isipan, upang makapagbahagi sila sa pamamagitan ng kanilang puso. Siya nawa.
Ladies and gentlemen, the Philippine National Anthem. Once again, a pleasant morning to each and everyone. The Department of Elementary and Secondary Education in cooperation with the Community Development Team of the College of Education and Simbayan Community Development, welcomes you to Inclusionem 2021, Strengthening the Homeschool Partnership and Education of Children with Special Needs in the New Normal. To formally welcome us, let us all welcome our beloved Dean, Associate Professor Pilar I. Romero, our beloved Dean.
Good morning to our esteemed guest speakers, Dr. Jack Alexander Herrin, and to Ms. Chu Beltran, our former academic staff, our dear regent, the chairs of the Department of Elementary Education, Dr. Carmina Vicente, and the chair of the Secondary Education, Assistant Professor Alvin Ringo Reyes. To all our academic staff, to our students and guests, and a special shout out to our guest from Flores Island in Indonesia, led by Father Dr. Maximus. Good morning once again to all of you. You know, I would describe our times, and this is not original. Actually, this comes from Vatican II, Gaudium et Spes, that we live in the best of times, and we also live in the worst of times. We live in the worst of times. We know how the pandemic has caught us in the grip of fear, anxiety, has thrown economies into the depths. It has shown how the world can be put down on its knees. We live in the worst of times, not only because of the pandemic, but because our world now is also caught in the grip of terrorism, of hunger, poverty, and inequality. But we also say that we live in the best of times. And why do we say that? Well, because we see how progress has come about. Progress in the field of technology. Technology, we harness its affordances in various fields, in communication, in medicine, in education. It has also brought so much economic progress to the world and to the different economies in the world. But when we speak of progress, we do not only refer to economic or political progress. We live in the best of times because we see what I would call moral progress. This moral progress is seen in the shift of our mindsets. And consequently, such shift in our mindset also brought about the shift in our attitudes. We have progressed in terms of our understanding of what is the true meaning of sexuality. Thus, we now reject the myth of the superior male over the inferior female. Ironically, I would say that this progress is a throwback to the original idea of sexuality rooted in Genesis. We have progressed also in our understanding of what it means to be human. We now reject superiority based on ethnicity, faith tradition, and socio-economic status. This belief or shift in our mindset has fueled our resolve that no one deserves to be enslaved simply because of the color of their skin. This is again a throwback to Paul's letter to the Galatians, chapter 3, verse 28. This conference, I would say, is a leap towards progress. It breaks down the barriers to our commitment to embrace diversity, to foster inclusion, and to celebrate the beauty of the uniqueness of each person. With these thoughts and this commitment, I welcome you to this morning's conference. Let us all strive for genuine progress. Good morning. And I'd like to also greet a wonderful morning to our partner for this morning's conference, the Simbahayan Community Development Office, both at the College of Education and the university. Good morning once again.
Thank you very much, Dr. Romero, for your kind and warm welcome. As we continue our journey towards inclusive education, we really indeed need to celebrate the beauty. And to start that beauty, may I call on Assistant Professor Bernard Saldivar to introduce us our first resource speaker.
Good morning, everyone. Allow me to introduce to you our first speaker for today to talk about the topic, the science behind the development of children with special needs. Dr. Jack received his bachelor's degree in biology from the University of the Philippines, Diliman, and his degree of Doctor of Medicine from the University of the East, Ramon Magsaysay College of Medicine. He has completed his residency training in pediatrics and postgraduate fellowship training in developmental pediatrics at the University of the Philippines, Philippine General Hospital. Currently, he is a visiting consultant in multiple world-class private institutions such as St. Luke's Medical Center, BGC, and Cardinal Santos Medical Center. He is also involved in various educational institutions, either as an in-house developmental pediatrician or as a lecturer. Ladies and gentlemen, without further ado, may I present to you one of the sought-after developmental pediatricians in the country today, Dr. Jack Alexander Herin.
Hello, good morning.
Good morning, Dr. Jack.
Hi, Teacher Bernard. How are you today?
I'm good.
I want to thank everyone. I want to greet everyone, and I want to thank you for inviting me to speak in front of you today. Let me get my slides up. All right. So today I was tasked to speak about the science behind the development of children with special needs. I put a subtitle here, no? Increasing awareness for the needs of individuals throughout their lifetimes. I'm Dr. Jack, and I'm a developmental pediatrician. So let's talk about the objectives of this talk. In this talk, I hope to describe the various concerns parents may have regarding their children as they progress through the educational system. I'd like to talk about awareness regarding the presence of individuals with special needs, and to describe the more common developmental conditions that are prevalent today. And third, I would like to, of course, emphasize the need for a customized plan of management when dealing with each individual student's needs, advocating for every child's right to an education. So if you think about it, in 1990, we had the Convention on the Rights of the Child from the United Nations. And among the different articles therein, of course, this is the one most important to us today, Article 28, which is the right for every child to have access to education. So in this article, they stated the need that primary education become compulsory and availably free to all. And of course, to provide secondary education, vocational education, and making them available again to every child. Now, other articles that are related to this are the second, the one that immediately follows it, Article 29, the aims of education, wherein we are looking to divide it into developing each individual's personality, their talents, their mental and physical abilities. We want to bring out the best in every child. We want to make sure that each child is able to develop in his or her own way. Now, we also see Article 23, wherein we are aiming to provide with children with disabilities. Now, this was the UN Council for the Rights of the Child was developed in 1990. So I know terminology has changed since then. We call them children with special needs, those who take a different path, those who are challenged maybe. I beg your indulgence here when we use the word disabilities. I know sometimes it does not sit well with others, but when we talk about children with special needs, of course, we are talking about those who go through life in a different way than maybe most of us do. But each person is still entitled to a full and decent life. And we want for these children, these individuals to still receive the same effective access to education, training, healthcare, rehabilitation sessions, and eventually, employment and recreation. Now, when we think about these three articles, we see that they are very compatible with the Sustainable Development Goals, specifically number 4, which is quality education. We want to ensure inclusive and equitable quality education for all and to promote lifelong learning opportunities as well for these individuals. Of course, it goes without saying that SDG number 17, which is partnership, I think that's a given. So let's get into it. What is development? We often talk about growth and development. And while growth is something quantitative, we look at weight, we look at height, development is something qualitative, which means it does change with time. It does start out as very simple and becomes more and more complex. So in this image, for example, you see a child who is starting to crawl, and eventually he becomes better and develops the ability to walk, to sit, to stand, to walk, and maybe later to run. The same way where when we were younger, we would grasp our parents' pinkies. Eventually, we learned how to hold different objects. We eventually learned how to use these objects to manipulate our environment. And maybe from there, we learned how to write, how to draw, and how to become more creative. So development is a qualitative determination of each individual skill. And of course, when we talk about development, it also means that each individual is unique and follows a different trajectory. While most of us would like to follow the same trajectory over here, we do know that there are different factors which could affect each individual's ability to follow that path. There are some who undergo delays for whatever reason. Maybe some of us do get sick, undergo trauma, have difficulties with when we were born, which affect our trajectory. It does mean, though, that we do not manage these individuals just in one way or in the same way, but we look to see what are the things that we can do that will specifically enrich their lives and help them out. Now, I'd like to go into some of the developmental conditions that we would probably see immediately at birth, or things that would affect individuals very early on in life. And I'll start with the dysmorphic syndromes. When we say dysmorphic syndromes, these are the conditions wherein we see that they may have they may be physically different from us in certain ways. And I think the most common genetic or dysmorphic syndrome is Down syndrome, which can cause intellectual disability. Now, Down syndrome is caused by an extra chromosome on the 21st, and what we see here is, I'm pretty sure you've seen individuals with Down syndrome. They may present with very common features, and we're not going to talk about all of those today, but we can see that they are also associated with certain difficulties. For example, children with Down syndrome may have eye problems, congenital cataracts, which would eventually affect their ability to read, go through life, maybe see things in the same clarity that we do. We see that a lot of them do need glasses or have errors of refraction. And we do advocate really early on that even as early as 6 months that they go through routine eye evaluation. Now, what are some of the neurodevelopmental conditions that are associated with Down syndrome? We do see that a good number do have seizures or epilepsy. Maybe a good 5 to 10% of them do have coexisting autism, which we will talk about a little bit later. A good number do have developmental delays, although we do see and we do have anecdotal evidence that there are a lot who actually finish elementary, intermediate, and high school education and move on to college. There are different characteristics, and each child with Down syndrome is not the same. And while we do see some behavioral issues as well, and we do see some depressive disorders for some, what we really want to work for is to treat each individual uniquely, try to see what each one will need to make them a better person. So other neurodevelopmental conditions, some do have some mild or moderate intellectual disability. A good number of them do have difficulties with expressing themselves. And we do look for other ways to augment their communication skills. So how do we manage some of these children with dysmorphic syndromes? I think the first thing really is early intervention through identification. So we do genetic testing. We take a look at the other parts of the body, their hearts, their eyes, their ears. We make sure that everything is optimum, or we try to manage if there are any difficulties there. We do some testing for thyroid, and of course, we refer for early intervention. And I think that's really going to be the thrust, and that's still part of the Sustainable Development Goals and the UN rights of the child. Really to go push for early intervention, because this eventually maximizes the amount of care that we can give them, and does allow them to reach their full potential. Okay, so other recommendations, of course, include counseling and family support. Aside from dysmorphic syndromes, early on, we do recognize children who may develop cerebral palsy. And cerebral palsy is a disorder of movement and posture. These are static disturbances that occurred in the child's brain, either right at childbirth or maybe even while he or she was in their mother's tummy. And when we say static disturbances, it does mean that this is not an ongoing process. So we talk about maybe a stroke or trauma or things that would eventually affect the structures of the brain, causing difficulties in movement and posture. And we see that a lot of these children with cerebral palsy actually come from those who have been delivered prematurely, or because of their prematurity, actually come out very small and weigh probably less than 1 kilogram. It's a nice thing, that modern medicine, through obstetrics and through neonatal medicine, have actually improved the survivability and the outcomes of these premature infants. So where maybe 50 years ago we would see high mortality, a lot of the premature births would end up not reaching the age of maybe 2 or even 3 years old. We do see now that since survivability has increased, there are so many more infants who are alive today. And yes, although they may have some physical difficulties, these are the things that we try to work on, because we still want to maximize their potential. So let's look, what are some red flags for cerebral palsy? Again, we talk about prematurity, maybe complications during the labor and delivery. Twin gestations or multiple gestations. When you have twins, yes, you are two individuals sharing the same womb. We might see later on that these children have some difficulties with feedings, or may have some sensory deficits, problems with their eyes, their ears, or other organs. And of course, we might hear of reports of epilepsy or seizures. And these are things that even from an early age, we ask parents to be very conscious about, very vigilant about, especially if they know that there are risk factors involved. And what do we see? We see children who have difficulties with muscle tone. They can be very spastic sometimes. And what we see that there are a lot of involuntary movements. Because of this, there are delays in motor milestone acquisition, and maybe you still see some of the reflexes that you would see in younger children those that were supposed to have vanished, they still appear in children with cerebral palsy, because there is no more ongoing process. There is no regression involved, although we do see a lot of delays motor-wise. I do know of some patients who have not been affected cognitively. So they are in school, actually, and progressing through the elementary school system, although they do have accommodations for their physical difficulties. One physical difficulty, of course, is include orthopedic concerns like contractures for spasticity, making it very difficult to manipulate objects or to write. So they might have contractures in their extremities. For those who are severely spastic, they might have difficulties walking because all their muscles are pulling at the same time. Some may have back problems and scoliosis, and of course, this puts the individual in chronic pain. And these are things that we do have to take into account, even when we see these children in our classrooms. These children do have some neurologic sequelae. We do see that 43% do have seizures throughout life. Maybe about 65% do fulfill the criteria for an intellectual disability or long-term delays in development. There are some neurodevelopmental or neurobehavioral concerns, such as inattention, problems with attaining age-appropriate adaptive skills, or maybe even some self-injurious behavior, depending on their capacity and their potential. There are those with problems with their mouths being able to chew, process food, or even use their mouth to speak. Those with sensory impairments, eyes, ears, the other different senses. And of course, we also talk about concerns about growth and nutrition. Not being able to move, not being able to maybe eat properly does affect your physical activity and does affect your weight as well. Let's move on. So from dysmorphic syndromes to cerebral palsy, let's talk about something that is fairly common. We talk about, we go back to that slide with the trajectory of development, and we talk about developmental delays. And sometimes, even as a child grows older, we do see that some of the delays continue to persist beyond maybe 6, 7, or even 8 years old. And at that time, we do reclassify them as having an intellectual disability disorder. Maybe when we were young, they used to call this mental retardation, which is probably a term we try to avoid in this day and age. But we do see that there are significant limitations in a child's cognitive potential or intellectual functioning and the ability to take care of themselves or their adaptive behavior. And usually we see this originating even from an early age and before 18 years of age. Who are at risk? So we talk about the children who we talked about earlier. There are those with an established risk, maybe those with dysmorphic syndromes, or maybe those who have inborn errors of metabolism, those who are at biologic risk, meaning maybe they were conceived without any problems but underwent difficulties at childbirth, those who were premature. These are the children with biologic risk, or maybe even those with environmental risk, those who come from families wherein there is poverty, abuse, a lack of education, wherein their capacity is really not, it's not developed to its fullest, right? And there are those, of course, who have severe and profound disability, and maybe this is about 5% of all individuals with intellectual disability. And this is really where you would see that even trying to put them through school, even at home, there is a severe lack of self-help or survival skills, difficulties with communication, maybe some behaviors which appear inappropriate or stereotypic. There is really some, maybe hereditary source that we should investigate. But this also means that we do have to commit. We need a greater commitment to intervene at this point. And sometimes the potential, how far can they go? This is something that we will have to discuss, very often. And it is not something that we can maybe prognosticate even early on. And finally, of course, there are those with multiple disabilities going through the disabilities or disorders that we talked about earlier and the things that we will talk about a little later. There are those who have multiple disabilities, not just intellectual disabilities, but maybe dysmorphic features, cerebral palsy, all the same, seizures, difficulties with sensory impairment, and also those who have other developmental and behavioral disorders. And if you think about it, entering the school system may seem like a challenge, but the one thing I want to stress is I don't want us to think about it in terms of what does this child have, or what do you call this child's condition. In my practice, this has often been the case when dealing with parents. They feel very anxious, of course, about their child's ability to perform in school or enter school. But if you think about it, it's not so much as to what a child may have on paper, but it's really more of what are the needs of the child that we as educators, as doctors, as people who want to intervene and help, what can we do to help? And it really involves recognizing their needs. So let's simplify things a bit. I like to call this the timeline of concern, from birth all the way through maybe school-age children and maybe beyond. We see that each child at each stage of their lives do have different needs. And what we need here is really insight by the parents into what their children are going through. Maybe there is some comparison to the siblings to see, okay, so far so good, or maybe one child is lagging compared to their siblings. We do advocate for regular pediatrician visits because, sometimes we do need a pediatrician on board to point out to the parent that we do need some help. And of course, partnership with the schools. Pre-COVID and even now, the school, the teachers, you are all second parents to these children, and you spend a lot more time, I guess, on a daily basis with these children than sometimes their parents do at home. So let's move on. Let's talk about it in terms of the preschool age, the early and late school age, and adolescence. So when we talk about preschool, of course, we're talking about maybe 3 or 4 years old, thereabouts. And yes, some children do enter toddler classes at 1, 1.5, or 2, but we'll talk about it mostly about children at the age of 3. So what are some common concerns arising in preschool? Why do I talk about concerns? Because when we talk about concerns, we talk about what a child needs and not necessarily what does this child have. Everybody follows and sits within a continuum of needs, difficulties, challenges, and potential. So let's talk about it. There's language development, concerns about vision and hearing, their gross and fine motor skills, big movements and smaller, finer movements, maybe concerns about behavior, and concerns about social development. Let's start with language. Language acquisition is one of the most important components of a child's development, and we know this. Throughout, whatever grade you're teaching or whatever type of student you're teaching, you know that when you want to impart knowledge or teach a new concept, language is the most important thing because you have to get through to that child, and you want that child to express himself or herself back to you to show that they understand what's going on. Language represents objects or actions in symbolic form, and it's by this way that we communicate our ideas, our intentions, and what we're feeling inside, our emotions. And what do we see in some children? Maybe for some children, we see no language at all, even at 3 years old. Maybe a lot of us still remember the time when our parents would go, "Oh, your child is not speaking yet. That's okay. Your grandfather spoke at the age of 12. At the age of 12, we were in the 6th grade." So this is something, of course, that I want to stress. When you as a parent or even as a teacher dealing with children who are very young, when you do see things, when you do see red flags, this is something we are obliged to report or obliged to at least talk to the parents about. So some children do have no language at all, or maybe have difficulties even using gestures to get what they're feeling across. They might have language, but to a limited extent. They might use words that we don't necessarily understand, might seem like a foreign language to us. We do have some children who may not be able to attend or to engage you very well or respond when you call their name. Remember, it's not even about calling their name, but even tapping them on the shoulder and trying to get their attention. For some, this is still a different form of communication, but some children still have some difficulties. Maybe this child is not interested at all in communicating with others. Or maybe this child does communicate but has difficulties responding and is confused with simple instructions. As we progress, we see that, again, this is a continuum. It's not just one, a 0 and 100, but children fall in between a lot. Some children have short utterances, difficulties naming common objects, while some children are very verbal and can talk about different topics. Some children may be very verbose. They might be able to repeat things that they've heard, but these are all things that they've heard off the television, off YouTube, or maybe they hear bits of pieces of conversation. I do remember one child who I heard, and all he was saying was, "Hello? Yes, ma'am. Opo, ma'am. Sige po, ma'am. Thank you, ma'am." And what that told me was, okay, so you see the people at home answering the phone a lot, and that was the thing that he picked up on. You see that children express anger and frustration. We all do. But with difficulties in communication, our anger, our frustration does come out in a physical manner, as opposed to us talking it out. We do see children hitting, biting, hurting others, being aggressive. And this is also another reason why we want to develop age-appropriate communication skills. Of course, sometimes it's not even the content, but maybe it's something about the musculature or the way the structures of the mouth are produced. Some children do have lisps or difficulties producing speech sounds. Their articulation's a bit off. Some may stutter, and some have problems coordinating the muscle and the jaw. Now, this is why optimal language development is very important. And this occurs when we provide children with stimulating environments, things that are developmentally appropriate, especially from their adults from whom they model their behavior. For parents, this is as simple as reading aloud to their children, being very productive together. Maybe this is the reason why some children are put to school at 1.5 or 2, even when we feel that it might be a bit early, because maybe some parents are not able to do that at this point in time. But maybe one problem that we do have in the present really is that a lot of children are now being exposed to gadgets, watching videos, unsupervised. Now, if you go through recommendations, we do see that while TV or maybe television programs are not advocated for young children, there are some television programs which can be used. Of course, there are conditions to help teach children. Remember, what we're looking for is interaction between a parent or a caregiver and a child. Now, I'm pretty sure most of you know what this is. You remember this probably from your childhood. For our guests in Indonesia, this is Batibot, and Batibot is our local version of Sesame Street. I think you're familiar with Sesame Street. And the nice thing about Batibot and Sesame Street, even when we were younger, is that it was developed in such a way that the characters were not just telling a story that we would watch very passively and we would repeat, but they were actually involving us. They would pretend to talk to us. And probably as children, we would watch together in the living room with our brothers, our sisters, our parents, and we would learn together. Nowadays with gadgets, I can take my gadget and hide in a room and watch by myself. And that is very disconcerting. The learning there is unsupervised and very difficult to monitor. So this is what we are trying to look for. Not necessarily Sesame Street or Batibot, but more caregiver and parent involvement in having quality time with their children to develop their language. So let's move on. Aside from language development, of course, we have children who have difficulties with vision and hearing. And let's take a look. So some kids may actually squint or hold objects very close to their face. Maybe they have difficulties in maybe they're nearsighted, they're farsighted, but they can't necessarily tell their parents. As far as they know, this is what they were born with. So they think that this is, I guess, normal for them. And how do parents know? Even from a young age, you see them that they miss objects. They might bump into walls or they miss the corners. They start hitting corners. Sometimes they appear clumsy. Or sometimes for those who have different acuity in both eyes, Maybe their eyes hurt or their head hurts as they continue to strain their eyes as they grow older. Maybe some have very short attention span during when a parent is singing or telling stories because of difficulties with hearing. Remember that hearing is not 0 and 100 again, but hearing is really a spectrum again, or a continuity of difficulties in recognizing different sounds. So does the child turn his or her body towards the same sound, or does he speak in a louder voice? Maybe a child uses gestures more than words to communicate. Does this child have difficulties making sounds, articulation, or stuttering? Or does this child have difficulty following other people, or with their eyes, maybe does not respond to you when their name is called? Maybe this child has frequent ear infections, or maybe this child even has a high sensitivity to very specific sounds. Something to think about. Let's talk about gross and fine motor skills, big movements and small movements. Things to watch out for even at a younger age. Is one side more coordinated or less coordinated than the other? Are there age inappropriate movements, maybe tiptoeing most of the time, limping? Some things to watch out for. Are there difficulties with larger movements or being able to copy larger movements, like jumping or running or skipping? Maybe some children with their fine motor skills, they react very strongly to the feel or certain textures or substances. Maybe they have difficulty holding their pen or another writing instrument. Maybe even being instructed or after it is demonstrated, they still have difficulties copying. These are things we would like parents and even teachers to be more aware of. It's not so much that they complete the activity, but it's also something that they are able to understand and participate well in a class. Let's talk about play behavior. Play is another essential right of the child. Article 31, actually. And it's essential really to developing a child's cognitive, physical, and social and emotional well-being. Being able to play, even for us as adults, we allow ourselves to be creative. We interact with the world around us. It's a good teacher, really. It develops problem-solving activities, and it enhances our language. It allows children to practice being an adult without actually going out into the real world and endangering themselves. It does lead to confidence and resiliency, and because of the physical activity involved, does help build active and healthy bodies. And of course, it helps parents interact with them and learn more about themselves. Now, some children may have difficulties with play behavior. Some may avoid other children, some may be shy, have difficulty speaking to others, even if they really want to. There might be some lack of imitation. Of course, I use this picture in jest. Kawawa naman si Spider-Man, siya lang mag-isa dyan. Some may have little or no interest at all in age-appropriate toys, or may use toys in different manners. Some may have repetitive movements or activities. I'll talk about why this text is in green a little later. Other play behavior concerns may actually be difficulties with cooperating with others, being aggressive, trying to control the play of others, or being disruptive, maybe in a group setting, being very disruptive when playing with other children or destroying that of other children. These are things that we would also notice in school, and we do have to manage. Lastly, there could be some difficulties with social development or social communication. So again, we talk about engagement, attending skills, being able to respond well when his name is called or her name is called, or difficulties dealing with temper or excessive aggression. Maybe for some, their social development implies a disregard for limits and rules, or maybe unprovoked physical aggression, a conscious or malicious intent. Or maybe it's as simple as being unable to share or take turns. Even in preschool, it is very important that we recognize some of these characteristics of children. And with that, I'm going to move into our next developmental disorder, which is autism. We all talk about autism. It's something that we know about, we've read about, we are very conscious about these days. Autism is a continuity or a spectrum of different conditions, really. It's challenges, really, in terms of social communication, so social skills, interacting with others, and using verbal and non-verbal communication to get by in our daily lives. And of course, there is the presence of repetitive or restrictive behavior. But when we talk about autism, I want us to remember that these are a varying range of symptoms. And going through all this, no two children with autism are the same. And it's really a different combination of either intelligence or social skills, communication skills, different behaviors. You go back and forth. And I'll use this as an example. I found this on Facebook, so I wish I could credit the person who actually created this. People think that autism looks like this: 0, all or nothing, less autistic, more autistic. But it is very different. Autism actually looks like this. We all have different talents. We all have different challenges, and everybody is different. We all have our own uniqueness. So this person's autism looks this way, and his brother's autism probably looks the same way. So while they are both considered autistic, their symptoms are different, meaning that autism, the spectrum does not look like this. But in fact, we are all rainbows, or we are all a mix and match of different strengths and weaknesses. And it's really up to us as educators to recognize these strengths and weaknesses in order to maximize our child's potential. Let's go into the statistics for a quick bit. If we take a look at the prevalence of autism spectrum disorder, we see that it becomes more and more common. In 2000, when I started, just finished I started my medicine, my medicine education, it was 1 into every 150 individuals. But as of 2020, it was already at 1:54. In fact, we're waiting for the data from the 2020 studies to see how common is autism nowadays. We say that it is more common, not because there are more children, but more children are actually receiving the care that they need. They are being recognized. So in hospitals like UST, the censuses are piling up. You can see that more children are being brought every day because parents are more aware now of what is possible for their children. In a study that we did in our home society, we saw that, for example, taking into consideration our outpatient departments, there is no local data. So what we based it on was really the hospital census. And we could see that 27.8 or 28% of children who go in for developmental conditions were actually diagnosed with ASD or autism spectrum disorder. And again, another 28% were diagnosed for the first time. Following it over several years, we can see that roughly 30% of our patients are children along the spectrum. We see that this is more common really in males, and this conforms to US data. If we take a look at when they are diagnosed, although you can see signs and symptoms of autism early on, we see most of it really at the age of 3. Whether it is because they were recognized early on but had difficulties choosing whether they would go for consult or not, or whether it was because it does take time to be cued and seen. We do see that a good 50% thereabout were seen between 3 and 5 years old, which puts them at makes it a little difficult to intervene early, and we really wish that they would be recognized earlier. But something curious. Reasons for referral, we see that a lot of them come in because of speech delay and language delay. And this is why I stress really the importance of language and communication and really detecting difficulties early on. Because if this leads to better recognition, then we can actually do a lot more work a lot sooner. Autism is genetic in nature and its relationship is still not very understood. It does overlap with other neurodevelopmental disorders, as we talked about earlier. There are some environmental factors, maybe some medications or difficulties with pregnancy, multiple gestations, like we talked about earlier, maternal illnesses, and of course, infections. Some of these we can do something about when we go to our OBGYNs, and some of these are, things that we just have to deal with. But definitely, I think, one thing that has been debunked, autism is not vaccine related, and I'm not going to get into any more discussion on that for now. And what are some of the common initial concerns of children? We see that there is lack of social engagement, maybe some speech delay, concerns about deafness if they don't respond to you, and of course, regression. Regression is that word when we hear it. It is a loss of meaningful spoken language. You can see that some of the developmental milestones that they have already developed go away by 1.5 to 2 years of age. Loss of gestures, decreased eye contact, where once he would look at you meaningfully, now he doesn't even know you're there. Social withdrawal, and maybe even imitation and play skills. Maybe it's still there, but not as consistent as it used to be. Autism is defined as impairment in social communication and interaction, and the presence of restrictive and repetitive patterns of behavior. So going through our concerns with language earlier, these are the things ingrained. Deficits in social emotional reciprocity, or give and take, going back and forth. So engaging or responding to one's name, having intent to communicate, using verbal and nonverbal communicative gestures or behaviors for social interaction. So being able to engage people appropriately is very difficult for them. So we can see that here in this picture. Maybe some children have difficulties in developing, maintaining, and understanding relationships. We're not saying that it's impossible, but maybe some people don't understand it, or some individuals cannot process it the same way we do. So maybe they may have very little interest in being with peers, or cannot imitate adults, or maybe even interest in age-appropriate toys is not their thing. Some may have restrictive or repetitive behavior, such as interests that are abnormal in intensity or focus. So if your child really likes cars it talks about cars all throughout, and you can see that you really cannot discuss anything else without bringing cars into the conversation. Maybe that's something we should look into. Fixed topics or themes in conversation. And some have sensory difficulties, which we'll talk about later. Either you're too sensitive or not sensitive at all. We see this in some children who might be tiptoeing, who avoid certain textures, or who may have some self-stimulatory behavior. Now, for it to be considered autism, you must have seen this early on. So it's not something that develops at 8 years old, but maybe this is something that you see early on with some signs that may not be necessarily obvious until a child is a little older, such as social skills, making friends, having a best friend, which we will probably not have really when we're 2 or 3 years old, but we see when we are in school. So for the second, third, fourth grade teachers out there, this is really where you look at the interaction between different kids. And for anything to become a developmental disorder, you do need significant impairment. So if it is a problem, it doesn't necessarily mean it's a disorder, but if it is a significant problem affecting social, occupational, and other areas of functioning, not just for the child, but also for the quality of life of the family in general, that is something that we can talk about. And of course, they're not better explained by other disorders. So sensory processing can be over-responsivity, under-responsivity, or looking for certain sensations. So what are the goals in treating autism spectrum disorders? Let's try to minimize the core deficits, which are social communication issues and repetitive and restrictive behaviors. We look at the associated deficits there. We maximize their independence, of course, academic achievement, learning, it's very possible. Acquisition of self-help skills, self-care skills, developing play, and minimizing the behaviors which are inappropriate. And most children with ASD, of course, since it's a genetic condition, they remain in the spectrum as adolescents and adults, but maybe to a minor degree, depending on their ability to cope and to improve with time. They may still have some minor issues with social relationships, independent living, and eventually mental or behavioral health, but that's something that we can manage. And I guess the issue that we'll have to discuss also is what intervention is available when they are no longer minors, right? So let's go back. So after autism, we see that now we go into the early and late school age. Maybe some children come in with inappropriate behaviors, persistent language delays, or maybe even learning difficulties. So we'll talk about it in terms of attention, not being able to pay attention in class, maybe incomplete work, poor organizational skills, or maybe those who don't like working at all. And we can see that there are some whose behavior, we call them pasaway here in the Philippines, right? They are in constant motion, or caregivers cannot keep up. They are hyperactive or even impulsive. They can't sit still. They fidget in their seats, even if they're seated for 2 hours. They stand up for some, maybe the younger ones, and they get into fights in school. And we segue from autism to ADHD, or attention deficit hyperactivity disorder, which again deals with inattention, hyperactivity, and impulsivity. Okay, so we'll talk about each one. All right. So when we talk about inattention, of course, we talk about difficulties, not just in paying attention, but being able to fix your attention on one particular topic at a time and not being easily distracted, trying to remember what you're supposed to copy, finishing your work. When we talk about hyperactivity, we see younger kids who have a lot of energy, but cannot seem to stay in one place. And as we grow a little older, the hyperactivity does tend to wane, but we see impulsivity, maybe stomping our foot or fidgeting under the table or doing things without thinking things through. Okay, we divide ADHD into two, inattentive type and hyperactive/impulsive type. And the clinical features here again, you see them in more than one setting. So if your child is behaved at home but not in school, then it is not ADHD per se. You have to see it both at home and at school, or maybe at work or at church. And of course, the symptoms vary depending on context. Maybe you have a very firm parent or very firm teacher, so a child is more or less a little anxious when that person's there. So maybe some of the symptoms are subdued. There is clear evidence, there should be clear evidence that this does interfere. So like what we were talking about earlier, if it's just misbehavior, then we should work it up. But if you see this is persistent misbehavior over a long period of time, even if we try to do our best to fix it, then maybe this is where a diagnosis comes in. Now in preschool, you see hyperactivity, and inattention becomes more prominent when you have more concepts during the elementary years. When a child is adolescent already, meaning 10 and up, there's less hyperactivity and the child may just be fidgety. And we see that now during online class. A lot of children fidget under the table. It's not as obvious because of Zoom, but they feel jittery, restless, or impatient and waiting for the Zoom class to end. And what happens when you have impulsivity, inattention, and hyperactivity? Your school performance goes down. You tend to underperform. Underperformance is really associated with signs of inattention, while hyperactivity and impulsivity go hand in hand with peer rejection or accidental injury. Why? Because people sometimes don't even want to be around you. You might get hurt, you might hurt them. And these are the things that might turn other children off. And for older children, they do increase their risk-taking behaviors. This is the impulsivity talking. So we talk about barkada, we talk about drugs, maybe sexual behavior early on. And these are the things that we would like, even as teachers, as second parents, to really look and watch out for. Children with ADHD do have mental health issues as well. There's social rejection, which could cause, a lot of negative interactions. They're called lazy, they're called stupid, they're called irresponsible, maybe also by their parents because they're very frustrated. But in the end, we do have to understand that these things are neurochemical in nature, which means they do need to be addressed. And while they do have their own, they do have to own some of the behavior, some of it is really biological in nature. And because as they grow older, the social rejection does tend to magnify. We do see that there are some children who still have anxiety and depression as comorbid symptoms, or who go on to have more inappropriate behavior, so ODD or conduct disorder. So goals of management for ADHD, of course, is early recognition and diagnosis, having a system of rules at home, maybe undergoing counseling or occupational or other types of behavioral therapy. Consistency, of course, is very important. There is the possibility of medication, and of course, frequent reevaluation of their behavior. Are they improving or are they not? Some people bring ADHD along to adulthood, and maybe there still might be some problems there. You see these in individuals who have poor job performance, who have poor attendance, or their attainment of goals is very poor. Maybe they have difficulties sticking to their jobs or keeping their jobs. A lot of conflict, difficulties with relationships and their family, and of course, risk-taking behavior. You do see a lot of road rage or traffic accidents, and maybe a lack of self-care and obesity. Aside from ADHD, the one thing I think that is important here is the recognition of learning disorders. So we do see, even at a younger age, that some children avoid reading and writing. They have difficulties reading, they don't understand it, and their school performance tends to go down when we shift from the preschool goals of memorizing to maybe elementary when we have to do reasoning. And you see that, the children have only been memorizing and they really don't understand a lot. They have difficulties with the reading, the writing, and maybe even the math. And of course, this affects their ability to pay attention. So when we talk about learning disabilities, we talk about the ability to perceive or process information efficiently and accurately. It doesn't mean they're not smart, but it does mean that they do have difficulties. And it manifests during the first years of schooling, really, by persistent and impairing difficulties, meaning things that you try to work on, but you see that they continue to have difficulties, whether it's reading, writing, or math. And you can see that their skills may be below average for age. And while you can get good performance from them, it does take extraordinary effort on their part. And the best way to really confirm a learning disability or a specific learning disorder is really through clinical assessment and the use of standardized tests. Now, difficulties learning and using academic skills despite the provision of interventions, this is really what you look for. So difficulties with word reading, difficulties understanding what a word means, maybe problems with spelling, capitalization, spacing, and written expression. So these come from actual patients, asking them to spell, and this is a grade 2, grade 3 child. Book, stop, block, school. Fifth, bike, table, chair, horse, and make. And if you look at the other one, you can see that there are still reversals, even for a grade 3 child. So it's hard sometimes to understand what a child is trying to say or what a child is writing. And these are examples of specific learning disorder for writing expression, for written expression. We also see those that have difficulties with math. So there is dyscalculia, which is specifically this learning disorder for those with difficulties in number sense, number facts, or calculation, or even reasoning. And what's our timeline for this? For preschool kids, probably look at children who don't like playing games with language sounds, repetition, rhyming. They don't like songs so much. You can see that their language development's a little lower. Maybe they mispronounce words, they use baby talk or age inappropriate language. They don't really remember letters, numbers, days of the week, or they may fail to recognize their own names, even if this is something that they do every day. Now, as they move on to kindergarten, you can see that these are the ones who are a little resistant when they are being taught to write and to read. They may be unable to do maybe different shapes or write their own names. They spell in different ways, mostly how they hear it, as opposed to the nuances of the English language, which use double consonants or specific rules for spelling. They have trouble with phonemic awareness or breaking down words into the syllables. These are the things that we see in a kindergarten child, and which we should be really aware of. As they move on to the 1st to 3rd grade, we see that reading sentences becomes difficult. Reading aloud is slow, inaccurate, and effortful. And maybe this is the first time that a child will be embarrassed in front of his classmates who can all read maybe a little better. And this is where a child really learns that there are some difficulties that he needs to address. And especially if these things continue to move up as he moves into junior high or even middle school, there are reading errors, there are difficulties remembering maybe concepts in math. And these just tend to pile up if the foundations are not repaired. 4th to 6th graders may actually have difficulties with longer passages or chapters of books. They may read it well by themselves, but they mispronounce when asked to read aloud, or even in their head, they think they understand it, but they actually read it in a different way. And this is where things start to become very difficult because life just becomes more complicated. The academic needs and requirements become harder, but their skills are still not up to speed. Poor comprehension, trouble with reading small function words, spelling, and by this time, 4th to 6th grade, they really do not want to read in front of the class anymore and may actually avoid school, going to the infirmary or the school clinic if they know that they have a chance to read in class. Now, for adolescents and beyond, or even for adults, you see a limited interest in more technical, the more technical aspects where you have a lot of reading, difficulties with reading comprehension. We don't see spelling mistakes as often because Microsoft Word does autocorrect now. And that's a problem I've heard from a lot of teachers wherein children are not aware that they're making spelling errors anymore because their word processor does the correcting for them. They probably need to reread their material frequently in order to understand or to get the gist. So you can see why Starbucks makes a lot of money. A lot of people read and read and read and read. And the problem is what happens when peer pressure comes in? Everybody wants to leave and you're the only one left behind. If you're the one who needs more time to read, it would be good if you could tell them, okay, you guys go ahead. But most of the time, due to peer pressure, you'll probably leave. And that is where the children or the individuals, the teenagers, do need to set their goals as well and say, okay, I'm not going with you. You guys go ahead. I need to finish up. Goals on management. Again, if you notice, it always comes back to early recognition, setting a system of rules, starting intervention, meeting with the school, talking about interventions, maybe having a formal IQ test done or psychoeducational assessment, and recognizing limitations. This way, we can come up with accommodations for the children and the individuals. Lastly, this is not a developmental disorder per se, but I think all children have mental health concerns and mental health needs, which we need to deal with on a daily basis, especially those who are a little older. So we need to promote mental health in most children. These may not be a part of the curriculum per se, but we know that mental health issues might be a mix of nature and nurture. You might have the personality or the temperament to not feel good about yourself, have negative feelings, but it's the environment really that provides also a lot of the stimulus to push you in a certain way. And some children are really born for developing mental health concerns, especially if it runs in the family. So requisites for good mental health, of course, unconditional love, self-confidence and high self-esteem, the opportunity to be with others, encouraging others to help support them as well, providing a safe environment for them and providing appropriate guidance and discipline. So you take a look, if you can be with your friends, if you can see that your teachers are very caring and loving and support you, then the chances are, your mental health issues will not be as severe, or at least you will be able to manage them. Because when a child becomes older, they fall into anxiety and depression, which probably do not fall under a PWD-ID per se, but are real problems that our children, our students go through. ADHD becomes more visible, problems with conduct and oppositional defiant disorder, language disorders and learning disabilities that persist throughout childhood become further fuel for anxiety and depression. And there are still cases of domestic violence wherein you do get post-traumatic stress disorder. Why? Because a parent feels that their child is not living up to their dream of what their child wants, what they want for their children. Of course, we talk about other problems in school: bullying, eating disorders, grief, neglect, abuse. And what we want to do is really recognize this early, because when a child feels that they need to do something to improve their situation and they look at risk-taking behavior because it provides an escape, this is really where we need to seek assistance. So look out for the younger children, look out for nightmares, aggression, tantrums, fidgeting or problems with behavior, and breaks in routine. For older ones, look for underperformance in school, poor grades despite strong efforts, anxiety, school avoidance, and maybe even depression. So it's important to know that mental health has to be considered. It's just as important as physical health, and a child's development of social, emotional, and behavioral well-being is central to their overall healthy development. If you think about it, everything we discussed over the past hour is just the tip of the iceberg. Every child is actually very unique. Everyone has his or her own sets of needs. It's the management of these needs that has to be customized to the individual. And while we do have broad strokes, de cajon, there are times wherein we will really need to look into what a particular child will need to maximize their potential. Our respective vocations as educators, as physicians, as parents, it demands that we do our best always to bring out and maximize the potential of all our children, of all the people under us. So I look forward really to coordinating and planning with you to attain our mutual goals. Thank you and good morning.
Thank you very much, Dr. Jack Alexander, for that very informative discussion about the development of students with exceptionalities. Before we proceed to our question and answer portion, I would like to formally acknowledge Assistant Professor Froilan A. Alipao, Director, UST Simbahayan Community Development Office, our partner in Inclusionem 2021, and all our partners from the Department of Education from different district and division offices. Also, we'd like to acknowledge our attendees from Ruteng, Indonesia, headed by Dr. Maximus Regus, Dean of the Faculty of Teacher and Education, Indonesian Catholic University of St. Paul. Also, Dr. Albert Rufinus, Director of STKIP Pamanet Talino, Indonesia. I would like to encourage everybody to key in their questions for Dr. Herin. And also we are live stream in YouTube page of the College of Education. So let me read some of the comments here. Dr. Herin, thank you very much, Dr. Herin. According to Neil Buenaventura, your presentation was indeed very informative, according to Bianca. And we also have a YouTube comment that indeed recognizing strengths and weaknesses would allow us to see the person's potential. And thank you so much, Dr. Herin. Learning a lot from your talk.
Thank you, po. I'd be happy to answer any questions you might have.
Okay. For the questions, there's a question here, Doctor, coming from Ma'am Eleanor a while ago.
Sorry, with me.
The question is, well po, Doctor. So the question was, we'll just ask it, Doctor, later.
Sige, hindi ko rin mahanap. Go ahead, please.
I'm actually looking for it. Here's a question. Question for you is, what are your thoughts about using walkers for infants?
Walkers for infants. I think there are some guidelines already. Speaking as a pediatrician, there are some guidelines already using walkers. First and foremost, we have to be responsible parents and caregivers as well. There have been incidents wherein a child is on a walker. Remember, when you're in a walker, you're really subject to that. Kumbaga, you really cannot control the direction of the walker except with your feet. But the problem is a walker is there to help promote your walking. So we do have problems with safety sometimes when a child is in a walker but accidentally maybe falls off a flight of stairs, or the place is not barricaded enough, or yes, they don't fall, but it doesn't necessarily help you walk earlier as well, right? So I do believe the current guidelines do not necessarily advocate for walkers, but I would recommend really that we, when your children are at that age when they're about to walk, we really look into spending more time with them, but we also be very conscious of their safety. And so we child-proof our homes, corners of tables, sharp edges, ability to maybe, the breakables, we take it out of their way. That way they have a very open area where they can walk and maybe stumble, and we help them stand up again.
Thank you very much, Doctor, for answering. Let me read to you another comment from our attendees, from Assistant Professor Maripia Rabacal. Thank you, Dr. Herin, for sharing with us your expertise. You covered a lot of uniqueness of children and highlighted essential information we need to know as educators and parents, useful in assisting them in school and in life. There's also an insight here that states, a good environment will always be a huge contribution, especially to children at a young age. Thank you so much, Po, for this talk. And another from Echo Handusay, very rich presentation. I have learned a lot, Doc. Thank you to our first speaker. It is truly indeed, Doctor, that knowing the development of our learners is very important as knowing the goals for them. Because I believe that this development would somehow lead us to a more inclusive way of seeing education.
Sir Noel, there are still questions. Perhaps we can address them. A question from Ma'am Pia. I think it's a very good question.
Yes, Dean Romero. Here's the next question, Dr. Jack, from Assistant Professor Pia, Doc Herin, is pre-referral instructional intervention provided by teachers really essential for children who are at risk? Thanks po.
Okay, when we say pre-referral, we're talking about, of course, identifying first. That's right, diba?
Yes.
Just want to make sure I get it correctly. I think that, all children who do have, again, we're not talking about it in terms of special needs. We're talking about children who may have concerns, whether it's your parents' concerns, it's concerns that you observe. I think it's something that we all do need to recognize first and foremost. And, when we recognize it, then we can do something about it. That's really where, in terms of schools, we really do advocate for regular team conferences to include, if there are interventionists involved, the teachers, the parents, making sure that both parents come to a PTC. And I still get so many PTCs na wala yung tatay, wala yung nanay. Sorry, busy, next time na lang daw. But you really need a team to work on it. It needs a village to raise a child. So when it comes to concerns, I think, we really need to recognize these early on and do something about it.
Thank you very much, Doctor. Another question, Doctor, is as a language teacher, this is from Mr. Alvin Ringo Reyes. As a language teacher, I am particularly interested about language learning and socialization. Is there any ideal age when we must introduce children to technology and the internet so as not to hinder language acquisition and socialization during their early years?
Okay, well, if you take a look really at the guidelines for gadget use from the American Academy of Pediatrics, which our local Philippine Pediatric Society has also adapted. We talk about screen time as being, well, the current guidelines say that at least for a child who is less than 2 years old, if you are going to be introduced to a gadget, let's make it something that can be used worthwhile. For example, we would be using a gadget for Zoom or for FaceTime to talk to your father who is in UAE or who is working in Taiwan, but not necessarily for games, not necessarily to watch videos. Sometimes children will learn about gadgets passively. Ang kuya, ang ate nila are watching in the other room, or their grandparents are watching the news. So that is where they are first introduced to television. And I would probably introduce it that way. Why? Because I want more time for parents, for caregivers, grandparents, grandparents, brothers and sisters, aunts and uncles, to go ahead and play with the child, read to the child. Now, you talk about the introduction of technology, but if you think about it, socialization does not come from the technology. Socialization comes from us. So if it's socializing with your father using FaceTime, that would be great. But to watch a show per se, for only to introduce the technology, I don't think that would be a priority per se. We can teach language through face-to-face interaction, which is more dynamic. Now, to say that technology is never going to be introduced, that's impossible. Even in our own families, the fact that everybody uses gadgets, sooner or later a child will be introduced, but there is no age when we should introduce it. I think that, if we're introducing it for the purpose of, so I can teach my child how to access the internet, by the time they're old enough to enter school, the internet will have been so much easier. Compared to 10 years ago when we needed a dial-up modem pa to connect to the internet, now it's just Wi-Fi. Anybody can just buy from a store, connect to the Wi-Fi within 5 minutes. So it's not so much the introduction of technology, but really the promotion of language through face-to-face interaction, or at the very, most, interaction through gadgets, because that other person you need to talk to, your family member, is too far away or cannot be in front of you at the time.
Thank you very much. Sir,
I'm sorry, and for intervention services. Syempre.
Thank you very much, Doctor, for that. Doctor, there's another question here. There's a question from Miss Cassandra Manuel. My question po for Dr. Herin is, may instances po ba na nagkakamali ang DevPed sa pagbibigay ng diagnosis? For example, during first assessment na diagnose and my signs ng autism. Then after 6 months re-evaluation, nanggaling na sa therapist yung kid na recommendations. Tapos, sobrang improved ng kid to the extent na halos nawala na yung signs and red flags ng autism.
All right. First and foremost, any doctor, any person, remember, is only human. And what we see in the clinic is what a child presents. So, we don't necessarily live with the child, but we do base our diagnosis as much as possible on observation of the child, history from the parents. And it's not a one-time, big-time thing. Although, yes, we don't see them as often as we would like. Siguro what I would probably say is that, a child can evolve, meaning a child who has received no intervention and is seeing a doctor for the first time will definitely not have maybe the skills necessary, which is why the parents brought them for assessment in the first place. But I think it's also a testament to the parents and to the intervention team that they were able to help the child reach his potential, or at least go up that path, and to recognize all the improvements he has made in that span of time. Without trying to sound self-serving, I don't think it was necessarily a wrong diagnosis, but it is really, like you said, from the basis of the question, the child has improved to a point that the signs and symptoms of autism, or whatever the child was diagnosed with, are not anymore as visible, and that's always a good thing. So in the end, I think it's a victory and a win for the child and for everyone involved, for the team. But remember, at the end of the day, all these labels are there not to put a child in a worse place. If a child is diagnosed with an attention deficit hyperactivity disorder or autism, it's not there because we want to make the family feel bad, but it is there so we can recognize and share with the intervention team that these are the needs of the child at a particular time. Knowing he or she might fit into a particular diagnosis is really there privately between the family, the doctor, and the intervention team, para we can work on it. Diba? At the very least, at the end of every consult, every developmental pediatrician I know, ang goal lang namin is to at least have the parent agree that we need to start working on improving their child. We don't even have to agree on a diagnosis, but let's agree that we recognize that the child needs help and we would like to start intervention as soon as possible. That's all I ask for my patients.
Thank you very much, Dr. Herin. Now, Doctor, we have so much questions here, but we'll be running only for 2 more questions. And
Can I answer this one? Private message though. I'll be quick about this one.
Yes, Doctor.
Thank you for your question. Intervention is costly. We talk about intervention. No? How can parents help their kids with autism if intervention is impossible because of costliness? To answer this question, yes, I know that maybe compared to other countries where the government can subsidize intervention, a lot of us here in the Philippines actually have to pay out of pocket. Understood. One thing that we advocate also is really, at least on the part of your doctor, if your local government can help subsidize, let us know. We'll help you write the referral letters. Second, what do we ask from the interventionists, whether you're a SPED teacher, an occupational speech therapist, physical therapist? We ask parents to get more involved, meaning don't just bring your child to the center and wait for things to happen, but ask, what can I do in the 5 days that my child has no therapy? I bring my child to therapy twice a week. What about the 5 remaining days? What are the things that mommy can do? Can daddy can do? Can lolo and lola? How can we contribute? And one family I know from Bulacan, I practice in Malolos, and they came from San Ildefonso, and they can only afford therapy once a month, which for maybe other families is once a month. What do you expect to learn there? But you could really see the mother taking meticulous notes. Every time she would ask very good questions. She would take videos of her child performing in different ways. Why? Para every time every time that they had therapy, they would show the videos. They would try to gain as much from one session and then apply it at home. Remember, now it is not that difficult. We can email, we can have Zoom consults. So actually, even going through therapy, although yes, there is a cost involved, ang habol natin is how can we still ask for help outside of a formal session? So that is my advice to you. let's maximize the time outside the session, are really looking at what we can do at home as our child's own therapists or interventionists.
Thank you very much, Dr. Harin. Doctor, this is our last question for this morning. Doctor, the question here is that in connection to screen time, what are your thoughts about online learning in the early years, particularly for 2 to 5 years old?
Well, okay. Well, if you think about the 2 to 5-year-old age group, kasi, these are the kids who have probably never had face-to-face learning at all, unless they started at 1 or 2 years old. It's been almost 2 years since the pandemic started. And yes, I do see that maybe some of the older kids who are in online distance learning now, they adjusted very well because they know what a classroom is like and they know how they are supposed to behave in the classroom. In terms of screen time, I would probably advocate for the 2 to 5-year-old. Well, again, if you think about it, this is a time when they are highly supervised by their parents. I still don't know of any early education program that is held online where I do not see any parent or at least a caregiver beside the child during the online class, which is great, which means that even if the child is there only for 20 minutes, and really for a 3-4-year-old, I do advocate less than an hour worth of school time. Remember that a lot of the skills there are to promote maybe socialization, even limited. If you're in a class of 5 or class of 8, at least you know that you're not the only student there, and maybe there can be some circle time involved. But a lot of the skills, you don't need to waste the screen time by, okay, do the writing, I'll give you 20 minutes, tapusin natin. No, do that as homework. Those are the asynchronous sessions that the parents can work on with their kids. Preschool, the preschool part is really about delegation, introducing concepts during the online synchronous part, but really using the asynchronous part to empower the parents to really be creative with their children, maximize the time that, yes, they're working from home, but they also have to give time to their children and find ways to budget and maximize their time. So let's do it this way. Synchronized teacher. Teach as many concepts as you can, introduce a lot of things, promote socialization, that's great. But once it becomes asynchronous, which is later in the afternoon or whatever time the parent can give to their children, that is where you put the tasks, put the tasks down and you let the parents try and work on it with their kids.
Thank you very much, Dr. Harin. Dr. Harin, may we humbly request, since we have overflowing questions, may we humbly request to kindly answer them po via chat po. So,
I will do my best.
Thank you very much for Dr. Harin. Now,
Thank you.
on this part, may we call on Assistant Professor Myra De Leon to award the certificate for our first resource speaker.
Thank you very much, Dr. Harin, for the very substantial discussion. And at this juncture, we would like to give you the Certificate of Appreciation from the University of Santo Tomas College of Education. The Certificate of Appreciation is given to Dr. Jack Alexander C. Harin in grateful recognition of his invaluable time and expertise as a guest lecturer on the topic, The Science Behind the Development of Children with Special Needs, held on October 1, 2021 via Zoom video conferencing as part of the National Teachers Month 2021 celebration with the theme, Gurong Filipino, Katuwang sa Hamon, Kasama sa Pagbangon. Signed by Assistant Professor Carmina S. Vicente, LPT, PhD, Chair of the Elementary Education Department, Assistant Professor Alvin Ringo C. Reyes, LPT, MA, Chair of the Secondary Education Department, Associate Professor Pilar I. Romero, LPT, PhD, Dean of the College of Education, and Reverend Father Maximo P. Gatella, OP, PHL, Regent of the College of Education. Thank you, Dr. Harin.
Thank you, po. Thank you for the opportunity to share today.
We are really grateful to have Dr. Jack Alexander C. Herin for the first part of for today's lecture. Now, may we call on Assistant Professor Marie Pia Rabacal to introduce our next guest speaker.
Thank you, Sir Noe. Our last speaker for today started her career as a trained Montessori class directress, devoting a decade of her working years practicing the teaching philosophy of Montessori. Shortly after venturing in special education as teacher overseas in 2006 to 2009, she joined the University of Santo Tomas College of Education, initially as an instructor and later on as the coordinator of Bachelor of Elementary Education Department. During her stay in UST, she also took other various important roles such as Educational Technology Coordinator, Certificate Program Educational Technology Course Developer, and the UST Representative for Information Communication Technology, United Nations Educational, Scientific, and Cultural Organization, also known as ICT UNESCO Regional Distribution Training Center. Also, Ma'am Chu, as we fondly call her, is a former member of UST Inclusive Education Multidisciplinary Team, an externally funded research group spearheaded by the College of Education, together with the College of Rehabilitation Sciences, Faculty of Medicine and Surgery, and the College of Science. The team worked closely under the UST Research Center for Social Sciences and Education from 2015 to 2020 for a public-private partnership with the development of education. Through this program, the team was able to have a glimpse on the inclusive education practices in some selected regions in the Philippines, which guided them in the creation of Ugnayan, Sanayan, at Tulayan, transformative inclusive education readiness program for kindergarten and grade 1 pupils in the public schools. They developed 3 tools: the Disability and Sensitivity Awareness Manual for Teachers, tool for measuring acquired skills or TUMAS, which is a screening tool for children ages 5 to 6 years old using play-based activities, and the Pre-Referral Instructional Support Manual or PRISM. PRISM was created to support teachers in handling children manifesting problems or delays in their regular classroom before taking professional assistance. It contains various activities recommended and conceptualized by the UST Inclusive Education team, which is composed of SPED teachers and allied health professionals, which the general education teacher may employ inside the classroom based on the perceived needs of the child. In all these tools, Ma'am Chu diligently contributed her expertise on socio-emotional development areas. Currently, she is the Special Education Director from Head Start to Year 12 of Ajo Unified School District in Arizona, USA. She also stands as a Crisis Prevention Intervention Trainer, USA First Aid Instructor for Youth, Coordinator of Project ESEL, meaning Empowering Arizona with Social Emotional Learning, which is a research program between Kansas University and Arizona Department of Education. Indeed, a competent, compassionate, and committed Thomasian educator. My dear students, colleagues, and friends, to talk about effective homeschool partnership and education of children with special needs in the new normal, let us warmly welcome our beloved Mrs. Marichu Tobias Beltran.
A blessed morning to everyone. Actually, I'm so speechless. I guess I'm missing my Thomasian family, especially my College of Education family. So let me just compose myself. So a blessed day to our Dean, Dr. Pilar Romero, to the administrators, faculty members, students, guests, everybody. Thank you so much for joining us today. And I am with so much gratitude that I'm part of this webinar. So I really hope that I would be able to give justice to the topic that you've assigned to me. So most of the contents of my my presentation actually are derived from my experience during this almost 3 years that our country or the entire world is being hit by this international health crisis. So it started December 2019 and up to now we are being faced of this challenge, and somehow it has tested our tenacity on how we will be on how we could embrace these challenges and be able to prepare ourselves stronger and greater in serving our students. So let me share my screen, and thank you so much, Ma'am Pia, for that introduction. I didn't expect that it's going to be that long, but I'm very much humbled of the introduction. So Teacher Chu would be enough. So let me share now. Okay. Okay, so I am tasked to deliver a talk about effective homeschool partnership and education of children with special needs in the new normal. So this is now what we are faced, this pandemic. So let me just give you a little background of the demographics of the district I am serving. We have around 50 students, 500 students, I'm sorry for that. And it's very diverse. Diverse in terms of culture, language, family dynamics, and religion, and of course, economic status. So out of 500 students, we have around 60 that we are servicing in special ed, and around probably 20 more new students will be qualifying for special ed eligibility at the end of this academic year. We have 3 dynamic and resilient special education teachers, one in primary, and these teachers, the one handling from students from Head Start. Head Start is equivalent to pre-K up to grade 3, and one teacher handling the middle school, and another teacher handling our high school, and also doing the transition program for our high school students. So this pandemic caused us to have a pandemic because last quarter of 2019-2020, schools here in Arizona, and I think also there in the Philippines, I was there in the Philippines sometime of 2019 to 2020. When I got back here around March of 2020, schools were forced to be in shutdown. So even though schools were in a shutdown mode, teachers were still expected to deliver instructions. I remember that time, the only thing that our administrators told us was communicate with the family, communicate with the parents, know what they need, and try your best to meet their needs in teaching their kids. So our school that time was in a lockdown. Kids were staying at home. We were also staying at home. We did not have anything but internet connection, our own laptop. Same with the parents. They were using whatever PDAs, personal digital assistant device that they had that time in communicating with us. So it was really challenging that time. It caused much frustration on the part of the parents. It caused frustration and also depression. It affected the mental health with most of our kids. These are typical kids, much more the atypical learners. It caused anxiety on the part of the educators because we did not have any tool to use in delivering our instruction. And probably it caused breakdown on the part of our administrators because they were bombarded with lots of questions and complaints, and they didn't know where to pull the answers for those complaints. So academic year 2021, the first 2 quarters, schools were still shut down, and we were just staying at home, still delivering instructions. But I could say somehow we got lucky during the first 2 quarters because our district purchased a software. They call it Ingenuity. It is kind of a program that contains all the learning areas, science, social studies, math, all the learning areas from kinder to year 12. So we thought we're okay. We now somehow have a source, a tool that we could use to our kids. Little that we know, it caused much depression because the standards included in that tool are actually very high for the students that we have, and there's no way for us to modify, to make any adaptations. So again, it caused frustration. So even though we had the tool that time, it wasn't successful, and it was merely like, okay, we're using this tool where we have something to use to our kids, just for the sake of saying somehow we're delivering instruction. But the evaluations, after gathering data from the evaluations, kids were really failing in all the assessments, in all the quizzes, and then many kids actually were pulled out, and parents decided to have their kids stop schooling first for at least the first 2 quarters because it caused mental breakdown, specifically to the middle schoolers up to high school kids. By the last 2 quarters, that was around January to May, our governor ordered that all schools should offer an in-campus services, meaning kids would be able to come to school, but parents were still given the option, should they want their kids to stay at home and receive instructional services via online, then that's fine. If they want their kids to be sent to a school campus for a face-to-face interaction or instruction, then that's fine. So that's what happened in our district, and it was very challenging on the part of a teacher because while you have kids in your classroom, you also have kids hooked online depending on you for the services. So you're doing it simultaneously. You're delivering an online instruction, and you have kids who expecting services from you face to face. So luckily, should I say, I'm not sure if it's we're lucky or not, since according to our governor here in Arizona, that majority of the adults, teenagers age 12, not yet a teenager, but age 12 up, are already vaccinated. So we were told that there should be no more online, not unless a parent would want their kid to be homeschooled and pulled out from the district, but all kids should come to school now for an in-campus services. So that's what we have been doing since August of this academic year. And now I say it's more successful, and we are seeing growth with our kids in all aspects, specifically in the areas of socio-emotional. But the challenge now is you'll never know any time that you will be asked to be quarantined because one of the kids in your classes recently diagnosed with COVID. So I was one of those teachers. 2 weeks ago, I was included in one of the teachers with the entire class of 35 kids quarantined because one was diagnosed with COVID. And recently, late this afternoon, an announcement was made in our district, like the entire department of high school should be quarantined and be tested, and they can only come back once the test is negative. So yes, we're vaccinated, but still it's not an assurance that you will be safe from this virus. So now, what I'm going to do, this is going to be an active participation. So I'm hoping that you have your other device with you, like your cell phone, and we are going to annotate Let me just see. I'm for sure you know how to annotate. So may I ask, or what do you call this one? On top of your screen, there is an icon there wherein you just have to click and you would see there the word annotate. And just let me know if you are having difficulty searching that one. So you just have to annotate and you are going to mark. So what are you going to do is in front of your screen, these are actually the 9 possible challenges encountered by exceptional learners during quarantine in a virtual or digital classroom. So for those who are catering to the needs of special needs, try to click on the top 2, which you think the top 2 of these challenges you think that's greatly impacted our exceptional learners during this school being closed. So yes, so kindly participate. So on top of your screen, you would see there 3 dots, and then just click on that one, and then just annotate, meaning just mark. So, okay, great, thank you. So there's one. Oops, I'm sorry, I'm really sorry. Okay, so we have one, lack of teacher, student, parent, yes. Okay, great. Being unable to socialize. Okay, I've been seeing lots of marks for number 5. Number 5 and number 1. Okay. Awesome, great. Thank you for your participation. Okay, so our top 2, I guess, if I'm not mistaken, is number 5, being unable to socialize, and an inability to adapt to distance education. Am I correct? Okay, so this one is actually a research conducted in Turkey. So they've made a study about the challenges encountered by exceptional learners during this quarantine in a digital classroom, and they had 15 participants in this, and the age range are 15 participants, 15 parents, and with kids with exceptionalities whose ages are from 9 to 14. And the different exceptionalities of their kids ranges from specific learning disability, autism, other health impairment, and speech and language impairment. And the top two challenges, okay, that they found out are, first, okay, is you will be surprised. I was actually kind of surprised, but reflecting back on what happened to the families here, because I was in constant, up to now, I am in constant communication with my parents here. First is inability to adapt to distance education. It was really hard. Sometimes you're teaching a kid, specifically a kid with ADHD, and would disappear from the screen or would cry from the screen. I even had a kid, by just merely opening the laptop, the kid would already cry because of the negative impact of technology to them. How I wish that technology would have a positive impact to them in terms of playing online games and watching videos. But if the gadget is being used for instructional services, they would really have the wrong notion that it's bad, it's something not pleasant, and they would start crying, having tantrums, going under the table, and mommy would get mad, and the kid will be spanked in front of the camera. So we've witnessed that one, and it was really heartbreaking. And okay, you'll be surprised with this. The next one is actually number 8, sibling conflict. So kids always fighting because they were just confined at home. They were not allowed to go out. They were not even allowed to go to the park to release that excess energy. So they always stay at home and pick on each other's siblings. So, and that caused much emotional burden on the part of the parents too. So thank you for your participation. Okay. Now, successfully making the shift for the educators. Okay, okay, thank you. Okay, successfully making the shift for the educators. This is from the National Center for Learning Disabilities. So we didn't have any choice. We really need to make this shift from delivering instructions in the school setting to delivering it at home. Okay, so how are you going to make it, or how did we survive? Okay, it wasn't successful, but somehow at least the kids were able to get a continuity in terms of implementation of their IEP goal. And then it would really be detrimental if we would not at least do anything, any opportunity for them to learn. So the first one is we need to be proactive in planning to serve the full range of learners, as knowing the uniqueness of the kid, knowing the needs, knowing the interests of the students, and move around those. Okay, move around those in planning how a kid could be served in all aspects. And and this is not only for special education teachers, general education teachers, but also for related service providers like occupational therapists, physical therapists, behaviorists, or speech therapists. Now, next is increased collaboration and communication among educators and service providers. During the pre-pandemic, we usually communicate to parents every quarter for the parent-teacher conference to discuss the progress report of their kid. Sometimes we communicate with them if there are some not so pleasant news, so that at home it can be addressed by the family. And our means of communication that time was really very formal. It's through email or mail. But now, all means of communication with all the teachers, I guess, even in the Philippines and even in other parts of this world, we've utilized all the means of communication, from cell phones, from emails, from phone calls, text messages, and even WhatsApp, Skype, and also FB Messenger. In my case, for me to know if a parent has seen the message that I've sent, the fastest way is through the use of FB Messenger. So it is not actually advisable before. I know it's not advisable for a teacher to have the parents be part of one of your friends in FB, but we didn't have any choice. That's the fastest way to communicate with them. And somehow it produced a more positive means of collaboration with the parents. And the parents have seen, like, this teacher of my son is actually human, not a robot, and should be respected during the time that she is not teaching, because she has this number of kids, and all throughout the day, this teacher has been communicating from one teacher to service providers, just to be able to meet the need of a kid. So really, there is an increased collaboration. All means of communication actually were utilized, and increased capacity and skills of educators. And that's you as an educator, you would really find ways on how you're going to enhance your skills and integrating technology in your teaching, and how you're going to make your presentation interesting to the kind of kids that you're catering. And if you are a special education teacher, you have to consider the eligibility or the exceptionality. So kids with autism, they have their own way of learning as compared to kids with ADHD, as kids with learning disability or emotional behavioral disorder. And as to kids with intellectual disabilities. So you really have to vary your presentation, the materials that you use, and the level on how you communicate with the kids, considering the eligibility or the uniqueness and the need of your student. So indeed, homeschool collaboration involves families and educators actively working together to develop shared goals and plans that support the success for all. During the pandemic, it's more of parents being partners, okay? Parents being involved in the education of their child, being involved like at school. Parents could attend a parent-teacher conference. Parents could attend the Parents' Day or Family Day. At home, parents will be able to help the kids if they have assignments. But during this pandemic, it's just not partnership. It's really collaboration. So it's not teacher doing more of the work and parents doing less, or vice versa. Equal sense of ownership, equal sense of accountability, and exhausting whatever available resources at home in catering to the needs of the students. So that is really what collaboration is. Now, we have to keep in mind also that collaboration will not require total agreement in values or educational philosophy. It doesn't mean like collaboration is just a yes, 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 boss. There would always be a conflict. In fact, if I see conflict in any organization, it's a good thing. Okay, it would give you challenge, but it is a good thing because it gives the head, the director, or even the principal, a time to reflect on how that conflict could be addressed and how else a program or a department could be improved. So, in a collaboration, even though there would be disagreements, arguments, conflicts, but as a team, we have to focus on the needs and interests of children and their families. It used to be needs and interests of children, and now we really need to put their families, because the family, that's the very thing constant in a child. As educators, administrators, we might be staying with kids for 1 or 2 or 5 years, but this kid will be staying with their parents for as long as the parents are still alive. Now, what could be the barriers to successful collaboration? Okay, now, if a member of the team would focus on the child's limitation instead of a child's strengths. Okay, it is true if we're going to refer a kid for a psychoeducational eval, we will be able to know the child's limitations. We will be able to know that a 10-year-old kid has a cognitive ability only of, let's say, a grade 1 kid, or let's say a 12-year-old, okay, or a high schooler only has a reading ability of a grade 3 kid. Those will really be revealed in a psychoeducational evaluation. But it doesn't mean that we have to judge a kid from there. That is very important too, because we'll be able to know where to springboard. Okay, if a kid is a 12-year-old and has only a reading ability of grade 1, we would know where to start. So instead of looking that limitation as something negative, look at it as a strength. Okay, this 10-year-old kid could read on a grade 1 level. That's great. So from that level, I'm going to pull that kid up. Okay, maximize up to what level I would be able to help this kid improve his reading ability. Another barrier would be teachers not showing up in the meetings. I remember our guest speaker a while ago, Dr. Herrin, mentioned like we will be calling for a meeting, special ed meetings, and that will not be there. Okay, all special ed meetings, the child should be there and parents should be there because they are the primary decision makers. So even though the teachers would want this kid, would propose this kid to use a certain thing or a certain plan in the IEP, if the parents would say, no, we don't want that, still the parents will be the one, okay? So we will still follow with whatever the parents would say because they are the primary decision maker. But of course, as a team, we would collaborate and discuss the pros and cons of our plans, of our decision, and hopefully the final decision would be more of how we will be able to help the kid, considering that this kid has limitations or this kid has a condition or eligibility. Third is another barrier is since in special ed, we do have lots of acronyms from A to Z. And sometimes when we communicate to other people, we assume that they already know what an IEP is, what a IFSP is or DD is. So they don't know that. So better use the entire word. Don't use the acronym because sometimes others might feel intimidated. So let's use the layman's term. And lastly, okay, this is actually based on what I've experienced. These are what I've experienced based on the meetings. I do not know anymore how many meetings that I've attended in special ed since I got this position. So parents bring negative baggage from prior school. So we really have to extend an extra understanding on the to the parents because it's really hard. Okay, it's really hard, especially if parents are not yet in the stage of full acceptance of their child's condition. So they still have that emotional, psychological baggage in them. And then even though it is not our fault, sometimes we tend to be the shock absorber of those. So these are the possible barriers for a successful collaboration. And there could be more. There could be more that you could add here based on your experience as being an educator or an administrator. Okay, now how are you going to build relationships with families? Okay, of course, ask how you can help the child. So how you could help the child, let the family, let the parents know that we are here to help your child. You have to build the trust with the family because if you're not going to build the trust, it is really hard to get the consensus. Okay, especially if you are going to propose a plan and you're not going to get the support of the entire member of your team, so your plan would tend to be sabotaged. So earn the trust of the family and acknowledge the hard work the parents are doing. They need to be recognized and let them know that we are with them in helping the kid. Like, you are such an amazing mother. You are exactly the right parent for your child. And just sharing my experience, like I think a month ago, I do have a very difficult parent. And this parent, the first time that I attended a meeting in this district as a special ed director, the very first meeting I attended is about the kid of this parent, and we had a lawyer during that day, and it was really an ugly experience because I wasn't prepared. But then I received a comment a month ago, like telling me, you are an amazing teacher. So coming from that kind of parent, I really appreciated it because it means like finally, after 3 years, she is now recognizing the hard work that the teachers are doing, and she is now recognizing the progress that her child is showing in all areas. Now, how to maintain a homeschool collaboration and partnership? Okay, of course, respecting the parents, okay, as the child first teacher. So Empowering also families. How are you going to empower them? One is provide them all the resources, okay? You might not be able to give them physically the resources, but what would be using the technology that we have, where would they be able to get resources that they can use at home in teaching their kids? And understanding learning as a lifelong endeavor. Is a lifelong process, and it involves family and communities. So learning would not just stop at school, would not just stop at home. Eventually, once these exceptional learners turns to 14 until they reach the age of 21, we need to prepare them for the actual life, like what would happen to them if we are not here anymore. So that is the transitioning from a school life to an adult person. So will they be going to community college? Will they be going to work right away after high school? So next is recognizing that all families want the best for their children and can have a positive, significant impact on their children's education. We all want the best for this kid. So the very first person that we need to empower would be the family. Sometimes you would receive a not so pleasant reaction from the parents. Sometimes they would tend to be not that outspoken to you, or they would tend to be timid or not that reachable. And it could be rooting because of they don't know how to reach out to us, or they probably had an unpleasant experience from their previous school, or they're exhausted. It's really exhausting if you do not have the right training, the right patience, and the right resources in catering to a kid with a condition. Is really exhausting and draining, and sometimes it would cause secondary traumatization or compassion fatigue on the part of the caregivers. So we have to consider also the mental health of the parents and also you teachers. Mental health is very important, because if we would not take good care of ourselves, these kids are depending on us, and these parents are also somehow depending on us. They are collaborating on us. So if we would not take good care of ourselves, it would have a negative impact to those people we are collaborating with. Now, okay, we're going to use again your PDAs. Kindly take out your PDAs, personal digital assistant, your cell phone. Kindly go to www.menti.com. And if you will be asked of a code, it's 4020 3946. Okay, now can I switch screen now? Are you now in menti.com? By the way, you could actually use this. You're probably familiar with some of the tools that I am using. Should you want your kids to participate or recitation, so that you will not just be the only one talking. If you are teaching your students, you could have them participate using this one. So would it be all right for me to stop sharing so I can go to Menti and see your response? So maybe just a thumbs up or yes or okay. Okay, so okay, thank you, Miss Catherine Shua, for putting in the chat room the link. So I could now stop sharing and try to see what your response are for a while. Okay, wow. Okay, for a while. Okay, nice. How to share it? Um, Okay, so look at your answers. Thank you so much. I am deeply honored and I'm so glad. Okay, I love this group, very participative. So benefits of collaboration, yes. Okay. Socialization, success, consistency, parents' responsibility, coordinated, it's moving, it's kind of hard to read. Time saving, better development, stronger relationship, awesome. Achieve goals. Okay, yes. So these are actually the benefits of collaboration, and we could classify this. Okay, the benefits could be for teachers, for students, and also for parents. Okay, so keep on answering. If you still feel like putting answers there, it's fine with me. So let me now go back to my screen. Okay, so these are actually, okay, I got this from National Association of School of Psychology, and these are, okay, let me just move this. Okay, so these are just some of the benefits of collaboration for students. I've seen that your response are very much close to this one. More positive attitude toward learning, higher achievement test scores, improve school attendance. Yes. Okay. You know, would you know that even though if it's an online one, we had kids were in our school uh, issued truancy because this kid has not been showing up online. It's already online. Still, the parents were charged of truancy. So educators, greater job satisfaction, okay, higher levels of evaluation or rating, more positive association with or for parents. And of course, for parents, improve communication with their children, better appreciation for their role in their children's education, and more positive experience with educators. So yes, so thank you for your participation. So now, the dual capacity, I do not know if you're familiar with this. You're probably familiar of this one, especially those who are taking courses in special education. Like I know we do have a course in that one, special ed, like about family, how you're going to support the family or collaboration between school and family. So this is a framework that we could use, okay, for you to know how are you going to have a positive collaboration, how educators and families would be able to work together. So this is called the dual capacity building framework for family school partnership. I do have a short video on this one. I want you to watch it so you would have a better grasp of what this is, and I'll be able to explain this to you later on after the video. Let me just access that one. Here it is. Okay, I guess we are ready. Okay, I guess we're ready now. Let's watch this one. It's just a very short one, very informative.
Ako na? Oh, ay, ikaw na
Ayan,
lahat. Sige.
Building framework for family school partnership was launched at the 2014 Family and Community Engagement Conference held by the Institute for Educational Leadership. This research-based framework was authored in collaboration with the
So are
United
you
States
sharing a
Department of
video?
Education and published by the Southwest Educational Development Lab.
Yes, I'm sorry. Is there let me know if you're having problem with the audio or.
We can hear the audio, but not the video. We cannot see the video.
Oh, how should I'm sorry, I forgot to share screen. Thank you for reminding me. Okay. Okay. Oh, okay. There you go. Can you see now the screen? Okay, so let me start. I'm
Yes,
really
ma'am.
sorry. My apology. Okay, let's start.
The first version of the dual capacity building framework for family school partnership was launched at the 2014 Family and Community Engagement Conference held by the Institute for Educational Leadership. This research-based framework was authored in collaboration with the United States Department of Education and published by the Southwest Educational Development Lab. The framework was created to offer a tool for educators, policymakers, families, and community members to understand what's needed to cultivate and sustain partnerships between home and school that support student achievement and school improvement. Since 2014, I've gathered information from current research and from stakeholders about what was useful and what improvements were needed to the framework. Stakeholders suggested that they wanted a new framework to reflect a sense of growth and improvement, and that educators and families come together by building the capacity of each side to work in deeper partnership. Second, the framework needed to more clearly articulate key challenges that got in the way of partnership between families and educators. For example, the new framework points out that many educators have not been exposed to excellent practice, and that's often because they simply haven't received any training in this area. Many families haven't been exposed to excellent practice either, and many have had negative experiences in school, both when they were children and as adults. The way forward starts with the essential conditions, which includes both the process and organizational conditions. These are the nuts and bolts that are a part of any effective family and community engagement practice. The process conditions describe the key components of effective practice to build partnership, and the organizational conditions describe the systems and structures, in other words, the infrastructure needed to support and sustain partnership. One thing that the field stated loud and clear is that all partnerships have to start with trust. We know from the research of Tony Bragg and Barbara Schneider how important relational trust between families and educators is to the effective functioning of a school and to the building of dependable partnerships among the adults. So this was moved to the top of the list in the process conditions. The organizational conditions set the table for the effective execution of the process conditions. The next section highlights the type of growth we should see when all the essential conditions are met. These 4 C's are based on research from my colleague, Monica Higgins. We all hear that term capacity building, but what does it actually mean? We know it's important for both sides to improve their knowledge and skills to engage in partnership. But Monica informs us that that's not the only element of capacity building that's important. Who you know, who you can turn to for information, is also an important part of capacity. We have research that reveals that our beliefs and values shift in positive ways as a result of working with others. Last but not least, the confidence of our families and educators to be able to do this work of partnership grows. And finally, in this last section, We see what happens when educators and families build their capacity to work in partnership with each other. We now have a reciprocal exchange that speaks to the power of both families and educators to support each other's continued growth. Educators connect family engagement to their day-to-day work with students and see families as contributors to their children's education. Families engage in various ways that make a big difference for their children's learning. And at the end of the day, we're able to see that this work truly helps us get to the outcome we're all striving for. More effective partnerships that support student and school improvement.
Okay. Okay, going back.
Everyone asks me, what have you done? Oh my gosh, you look so different.
Sorry. Okay. Okay, so this dual capacity building framework for family school, okay, let me just move this one, partnership. I actually did not have any idea about this last 2019, 2020 when we start servicing kids at home. But I've seen with my own eyes and I've experienced the challenges. Okay, like the differences between the educators and family. That time it was really hard to collaborate because in my case, I really do not know if parents would be comfortable me always communicating with them, telling them about their kids. But the only goal that I want to communicate with them is to help them and for them to know that I am there. They just have to let me know what they need so that I'll be able to help more their kids. And parents also were hesitant to reach out to us. So maybe because they had previous experience before, unpleasant experience, previous argument with the families, and that's why some parents were not that receptive with this. So when we've cleared through constant communication with them, we were able to remove those barriers and we became more comfortable communicating with each other. Like we don't mind anymore if the parent is busy doing something, if it's something to do with the education, with the needs of their kid, they would answer our text and I would answer their phone calls for as long as it's within the working hours. So somehow, even though we were not telling the parents that we cannot be communicated anymore after 3:30 or after 4, they already know the limitation. And probably they also got tired communicating already with the exchange of messages all throughout the day. So once we've address the challenge, okay, how an educator would communicate with the parents and vice versa, then we could now go to the essential conditions. The process conditions, this refers to the procedures, the applications, and the operations. The very first one here, okay, it was emphasized in that video is the relational. So it is very important in any kind of partnership, be it your mutual special someone, there should be trust, okay? Trust and respect, because if it's not there, the relationship would not last long, okay? It's always hard if you always have that doubt towards other person. And it's hard also if a parent does not trust you. How do you think a parent would react? Would this parent be able to entrust their kid to you if they don't trust you? And also on your part, if you don't trust the parents, it is hard for you to collaborate. There's always this invisible wall that you're not sure how you're going to approach the parents. Sometimes it feels like you're walking on eggshells if you are dealing with a certain parent. So there is also the asset base. It was not mentioned in that video. What is an asset base? Is I think the third one here. Like there's really diversity okay, in the classroom. Okay, just let's start in the classroom. There's diversity is actually very much visible. It is not something bad. It is actually something great. It's a rich source of information, diversity in terms of language, financial status, family dynamics. Those are actually rich source of information. So, but it is actually difficult if you have a very diverse classroom. How are you going to meet the needs of those kids? So instead of focusing much on the diversity, look first on what are the strengths of that kid. Sometimes we could consider also the diversity as a form of strength. So next, what else? So let's move now to organizational conditions. This refers to the infrastructure. So like it was clearly explained there, like for you to be able to sustain, okay, the partnership, it should have the adequate resources. It should have the adequate funding. Now, moving on to policy and programs, okay, there are also what they call here 4 C's, okay? As Tomasians, we have our 3 C's, but this one has 4 C's. First is the capabilities, okay? When you say capabilities, these are what we call the human capital. We are referring here to what are the knowledge, the skills, the qualities of the professionals or the qualities of the educators and the families, because these are the two group of people collaborating. So we have to consider the human capital there. What about the connections and the network has something to do with the positive result of the collaboration. So how these two communicate, we have to consider also the interpersonal skills of the educators and the parents. And the third one is the cognition, shifts and beliefs. So something to do with the person's assumptions, perceptions, beliefs, which are greatly affected by family background and culture. And lastly, confidence. So self-efficacy. So this is one's innate ability in accomplishing a very challenging task. So in here, we have to consider resiliency, tenacity. We also have to consider here, like for parents, teachers, and even learners, to consider mistakes, failures as normal. They are normal and they should not be discouraged once they would have a fallback or setbacks in their lives. So now, if there is, okay, if we would address the challenge and we've met the essential condition, we had the 4 C's, then we would have a great outcome. So there would be a great collaboration between educators because we've empowered the educators as well as the family. So they've acquired in them the needed skills for a positive collaboration. And ultimately, who would benefit on this one? Of course, the student, the learner. Okay, moving on. Okay. Okay, now, what are the strategies to promote partnership between educators and family? So create opportunity for families to provide input and help share their students' educational plans. In developing the IEP, most of the contents of the IEP should really be coming from the parents because it's only parents who would know their kids best. And we have to include families in learning how to support their children, especially now it is a home-based instruction. So kids are spending more time. Okay, kids are spending more time with their parents. So how are we going to give support to the parents so that parents would feel equipped in educating or teaching their kids? Thirdly is identify and use family's preferred mode of communication. Well, it's really up to you what would be their preference. But in my case, a lot easier. And they're comfortable inviting me as friends in FB. It's not advisable, but I'm not having problems at the moment, and we're actually productive in exchanging communication. And for as long as what you put in your Facebook account are decent, then you would not have any problem. And number 4 is create opportunities for the whole team to collaborate with families. So if a child is in special ed, at least once in a year, we would have an annual meeting to review the child's IEP. So that's a perfect time that we could collaborate and revisit the contents of the IEP and see if the contents are still suited, appropriate, applicable to a kid. If not, then we need to update or change some of those. Okay, so from parent involvement to partnership with parents. So this is more of empowering the parents. Since kids spending more time with their families and parents, how are you going to empower them? But first is when you empower them, empowered people have the means and knowledge to act. They know what they want and they take action to get it because they are empowered. You've given them all the resources, the skills, everything that they need. So they are equipped and they would not doubt themselves that they would not be able to do that responsibility because they know they have the source and they know how to accomplish a certain task, or they know how they would be able to help their child. So these are some of the resources. Okay, this is actually during those first 2 years that we were in a lockdown, I've utilized many of these, and it's not just teaching the kids, but more of also for mental health. That time I really need to take good care of my mental health because of some issues at school, and it's not that easy to be an administrator, and also some personal issues that I need to handle in my family. So I need to have I need to do a self-love so that I'll be more functional and I'll be able to serve more our school. So let me show you those. I think this is the one. Okay, so this is actually one site that I could show you. It offers not all of the resources here are for free, but many are for free. If it's just a video for mental health, like let's say self-care for educators. Okay, self-care for educators, you just have to click that one, and practicing, you just click on the link and you would be directed to tons of free resources that you could access. And like if it's something to do with social emotional issues, then just click on this one and you will be able to see tons of resources. Just click on this. Sometimes you'll be able to be directed to one school and see what are the practices that they have there and learn from them. See, resources to share with families. It's actually like a one-stop shop. It has everything that you need. If it has something to do with academics, you also have it here. See? Some of the technology resources that you can use for your students. So that is one way of empowering the families, also empowering the teachers. Okay, so kindly go to this site. This is just a very easy question. I just want to probably refresh your mind.
Remainder 19.
Okay, what happened? I'm sorry. I don't know what happened. Share screen. Okay, so kindly go to this one. If I'm not mistaken, this is Padlet. And then just let me know if you were able to get the link so I can go to that site and check your response. Okay, great. Okay. Okay, waiting for your response. On your screen, we now have the screen for Padlets. So if you could just write a word or a phrase of what is IEP to you? So what you know about IEP? Okay. Are you having difficulty typing your answers? Just let me know. Oh, thank you. Now I can see your response. Tailored fitted to the educational needs of learners, considering even their special needs. Okay. Help us better understand what the learner is capable of. Progressive development of children, to give support for each student, okay? Has their own strengths and weakness. Educational plan to meet the learner's need and provide further. Okay, very good, great. Okay, awesome. I really love this group. Okay, great. So, okay, I know you have more answers to put there, so I'll just be going back to this later, maybe after my presentation. I do not know how many more minutes I have. I'll try to finish this around 9:30. Let me go back to my slide. Thank you so much with your response, and I greatly appreciate your answers. Now, why did I ask this one? Okay, so again, I have to share my screen. It is really kind of challenging to switch from one screen to another, but that's all right. Okay, then there you go. Now I need to somehow present this to you so that at least you would have an idea how we were able to survive during those closure I could say closure era because of the pandemic. And I would like to specifically mention I was assisted here by one of my friends. She used to be a faculty member there, and she is actually helping me out here, Dr. De La Cruz. Thank you so much. So let's go to what an IEP is. Individualized Education Program. This is a plan, okay? This is a plan of a child aged 3 to 21. Special education is provided up to age 21. It focuses on the child's needs, and then this is delivered in the school setting. So you would develop goals, and all the contents of that plan should be implemented in the school setting. And naturally, the kids that we are catering in our district, these are kinder to year 12. So the age range are actually 3 already, 3 to age 21. We actually have severe kids with intellectual disability. 2 years ago, they've aged out, meaning they graduated in our district age 21. So age 21, all the services from special ed stop, okay, once the kid turned that age. And on the right hand, you have there the IFSP, that is Individualized Family Service Plan. So this is like an IEP, but for kids, okay, for little ones, for babies, birth up to age 3. So actually birth up to age 2.11. And instead of goals, we use the word outcomes. And these outcomes are being delivered at home. So why am I telling this to you? So we were able to survive in special ed with less anxiety when we've considered the contents of IEP and switch it over to IFSP. So what do I mean with this? So it's really hard to implement an IEP if the child is not at school. By law, we are still bound to implement the contents of this one because this one has a time duration. Here they don't care. For as long as a child is enrolled, we still have responsibility of executing the contents of a child's individualized education plan. So what I did, I was not that conscious, but probably common sense. I told to my other two teachers, like, we have to modify our IEP, and because we need to implement that at home. So we have to make sure that the proper way of implementing it, administering or executing it at home should really be suited with whatever resources at home, because that is now the learning environment of the kid, because the child is just staying at home. So we've supported mom to be resourceful and see whatever resources or materials that she has there in addressing the fine motor needs of a child, the physical motor needs of the child, even speech. So speech were delivered at home constantly. Our speech therapist would have a Zoom session at home and would see how the situation is at home and do an incidental speech services. So meaning whatever is happening, the speech therapist would capitalize that one, like conversation between one sibling to another, or how to broaden the vocabulary of a kid, on how to address the final sound, medial and beginning sound. So everything moves around to what is at home. Everything moves around with what the family needs and what the child's interests are and what are the strengths of the child. So that turned out to be positive, because of we modified on how we will be able. It was really hard for us. It was hard to think, how are we going to implement IEP? The child is not here, so are we just going to guess of the progress of the kid? But we were able to see progress when we switch some of the contents of the IEP and turn it into an IFSP, and then use home, the natural and learning environment of the child. So what is a specially designed instruction, SDI? So that is also one that we've utilized. SDI is actually what makes IEP special. It is closely tied to IEP because it is a way on how you're going to deliver, how a special ed teacher would deliver the contents of IEP, would teach the contents of the IEP to a kid by means of doing adaptations to the learning content, to the procedures, to how the child will be evaluated, and how the services will be provided to a kid. Okay, now, what would be the potential sources of conflict? I told you that anywhere you go, there would always be conflict, and conflict actually is a good one, okay? It's exhausting, it's draining, sometimes it's energy sucking. There are some people who would really suck your energy, but look at this way, like there's conflict because it's giving us a chance to grow. You as an administrator, you as a teacher, and your department to grow, to improve, to better deliver your services, or to improve the services that you deliver to the kids. First source of conflict would be planning. Okay, that can be a conflict. Okay, do I have 2 more minutes? Okay, so I was told that it's already time. So I just sum it up. So planning if the members of the family, they do not have common information of a child's interest and its implementation. If the contents of the plan not properly implemented, relationship is the manner on how we interact with the parents or breakdown in the communication. Sorry, I'm not checking my text messages. Sorry if I'm already over time. So let me just skip this one. This is what I want to present to you. This is actually my last slide. Okay, so what would be the best way of managing complex change? So switching from school instruction to home, that is a complex change, okay? So for you to have a successful plan, you wanted to implement a plan, make sure, okay, it will be successful if you have all these elements: vision, skills, incentives, resources, action. Now, what, okay? You would have a false start if you do not have an action plan. So let's apply this to a child in special education. Action plan is the IEP. So you have your vision. All as a team, you know the importance of making this change. Skills, all of you know what your roles are. Incentives, teachers properly paid, sent to trainees, resources, you have the tools, but you do not have the IEP. So that is a false start. It's like a treadmill. You're moving, but not moving forward. Stationary movement. So frustration, if there are no resources, you are expected to teach online, but you do not have the means in teaching it online. You do not have the devices. You do not have the internet. Of course, that's frustrating. Resistance, okay, teacher would resist or parents would resist if there are no incentives. Now, incentives is closely linked to vision. Okay, anxiety, if the teachers or the parents, they do not have the enough skills that they need. So they will be anxious. And confusion, if the team do not know the importance of switching this change. So that would lead to confusion, okay? And okay, so we will not do this anymore. Okay, I was told that it's already time. So I guess that's it. Thank you so much. So should there be any questions, let me know.
Thank you very much, Ms. Marichu Beltran, for that wonderful information that you have shared. May I read some of the comments of our participants, ma'am?
Yes, please do so. Thank you.
From Thank you, ma'am. From Ms. Marie Alonso, I agree, parental involvement is very essential in the education of all children. And also from Ms. Maria Cristina Agbada, I definitely agree, parent involvement is absolutely adjunct. And Ma'am Marichu, another comment is that teachers are trained to work with children or teach the children, but they are not trained to teach the parents how to teach the children. And we also have a question coming from our beloved Dean, from Dean Romero. How can effective partnership be forged when a number of families in the Philippines are in challenging situations? Absentee parents, parents who themselves suffer from mental health issues, and parents who lack the necessary educational capacity to accompany their children.
Okay, thank you, Dean Pilar, for that question. It's really very challenging, even here in the US. So it's already US, but we also have parents in the same situation. Like, even though devices are kind of provided to all the parents, but they do not have internet connection at home. So internet are not being answered by, shouldered by the school. So that also caused frustration on the part of the family. And in the Philippines, that's really something that's really disheartening. What I'm seeing from the news, what teachers are doing, they're printing out modules, so paper format on how the kids would still receive some form of education from the school. So that's the only source that I think or the only way I think that a family could be helped if there's really limitations in terms of sources. So at least paper and pencil, those printed handouts would be able to help them. There are actually lots of resources online, but still it would call for a use of technology and internet. So I'm not sure, Dr. Pilar, if I was able to answer your question.
Thank you, Ma'am Chu. Thank you.
Very much welcome po.
Thank you very much, Ma'am Marichu Beltran. Now, may we call on Assistant Professor Myra De Leon to award the certificate.
Nice to have you back, Ma'am Marichu.
Yes, Ma'am De Leon, thank you so much.
You know, she used to be with us in the college and the Simbayan Community Development doing ComDev works. That is why, next slide please. That is why the University of Santo Tomas and the College of Education gives you this certificate of appreciation given to Miss Marichu T. Beltran in grateful recognition of her invaluable time and expertise as a guest lecturer on the topic effective homeschool partnership and education of children with special needs in the new normal, held on the first day of October 2021 via Zoom video conferencing as part of the National Teachers Month 2021 celebration with the theme Gurong Filipino Katuwang sa Hamon Kasama sa Pagbangon. Signed by Assistant Professor Carmenes Vicente, LPT PhD, Chair of the Elementary Education Department, Assistant Professor Alvin Ringo C. Reyes, LPT MA, Chair of the Secondary Education Department, our Dean, Associate Professor Pilar I. Romero, LPT PhD, and our Regent, Reverend Father Maximo P. Gitela, OP PHL. Thank you, Ma'am Beltran.
Thank you. I'm very much humbled. Thank you so much for the opportunity. God bless you all. Love and light to everyone.
Again, we thank you, Ms. Marichu Beltran, for sharing your expertise this morning. Now, may we call on Assistant Professor Alvin Ringo C. Reyes, Chair of the Secondary Education Department, for the closing remarks.
Thank you, Sir Noe. I am part of a generation of secondary education teachers without any formal training on handling learners with special needs. During my time in college, early 2000, the term inclusive education was unheard of. True enough, when I was already practicing as a college instructor, I'm a Filipino teacher, by the way, I had an unforgettable encounter with a student that stunned me and made me reflect as a teacher. I was distributing the test paper I just checked, and when it was already the turn of this student, after receiving his paper, he suddenly went berserk. He said, "Ano ba yan? Lagi na lang bagsak." Or, "Why is it like this? I always fail." Then he pushed and kicked the armchairs near him. We were all stunned in the class. His classmates were frightened. I literally froze and didn't know how to react. Should I show the same force and call his attention before the class? Should I just ignore him, proceed with the lesson as if nothing happened? Should I send him to the guidance office? I don't remember what transpired in the class, but what I only recollect is the fear of not triggering the student further and the feeling of helplessness for lacking the capability, even the awareness, to cater to students with special needs. When I was transpiliated to the College of Education 8 years ago, I had the privilege of being exposed to the special education area, which for me is a milestone of my teachership because not only did it educate me on inclusive education, it also empowered me to do my best in making my class not only safe, but nurturing of learners with diverse individualities, even those with exceptionalities we are yet to discover. The 1994 UNESCO Salamanca Statement tells us Inclusion should be the norm. We must recognize that, I quote, every child has unique characteristics, interests, abilities, and learning needs. Education systems should be designed and educational programs implemented to take into account the wide diversity of these characteristics and needs. Those with special educational needs must have access to regular schools, which should accommodate them with a child centered pedagogy capable of meeting these needs because regular schools with this inclusive orientation are the most effective means of combating discriminatory attitudes, creating welcoming communities, and building an inclusive society and achieving education for all. End of quote. Employing the Latin term Inclusionem, which means to make part of, this webinar on strengthening the homeschool partnership and education of children with special needs in the new normal is our little contribution in reinforcing the mandate of education for all by reminding us that our educational efforts this pandemic must not only focus on the challenges and affordances of teaching our regular learners, but equally urgent and important, those with special needs. May this webinar not only increase our knowledge and understanding the nature of learners with special needs and equip us with strategies and technologies to cater to their educational needs, but also invite us to build a network of educators, parents, policymakers, and other stakeholders who will champion the cause, especially during these more challenging times. On behalf of the Dean of the College of Education, Associate Professor Pilar I. Romero, LPT PhD, and Regent Reverend Father Maximo P. Gatella, OPPHL, we express our deepest gratitude to our resource speakers, Dr. Jack Alexander C. Herin, Developmental Pediatrician at the Cardinal Santos Medical Center and St. Luke's Hospital in BGC, and Ms. Marichu T. Beltran, Special Education Director of Adjo Unified School in Arizona, US, for their invaluable time and expertise they have shared with us today. We also thank our partner, the Simbahayan Community Development Office, who made this event possible. This webinar is digitally published through the official YouTube channel of the UST College of Education. So if you wish to review the webinar or share them to your fellow educators, parents, and other stakeholders, feel free to visit and share the link to the content. And with that, I wish everyone a happy National Teachers Month. Let's champion the cause of inclusion. Mabuhay ang gurong Pilipino.
Thank you very much, Sir Alvin, for that wonderful and inspiring closing remarks. Now we call on Assistant Professor Carmina S. Vicente, Chair of Elementary Education Department, to lead us in our closing prayer.
Let us put ourselves in the loving presence of the Lord. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Heavenly Father, we glorify and praise you for your love and for the privilege of being able to share in this time together, to learn and gain new learnings. Thank you for bestowing upon us present here your grace and divine wisdom as we strengthen our camaraderie, partnership, and love towards one advocacy as we respond to the call of creating a more inclusive week for the greater glory of your name. As we leave this gathering, help us now to carry our new learnings. May they deeply impact our hearts, our relationships, and our lives. May your grace and divine wisdom be with us as we go with our daily lives and fulfill tasks for our profession, our teaching vocation. In Jesus' name and loving intercession of Our Lady of the Rosary, we pray this. Amen. Altogether, as we think and pray for peace in our country and our own personal intention, let us pray, glory be to the Father, and to the Son, and to the Holy Spirit, as it was in the beginning, is now, and will be forever. Amen. In the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Ladies and gentlemen, the UST hymn. Once again, we extend our warmest greetings to all the teachers who are celebrating the Teacher Month today. For the evaluation, kindly scan or use the code presented to your screen. Again, knowing the development of our students and having a good and quality collaboration between parents and teachers are the key to successful inclusive education. This is your moderator for this afternoon. I am Noenil R. Villanueva, wishing you a good and blessed day, and thank you.